My name is Michaela Keener, and I'm assistant professor in the College of Health Sciences, and I focus on equestrian health. We're part of the Equestrian Athlete Initiative, and our overall goal is to optimize the health, wellness, and performance of equestrians through research and community feedback. Back in 2020, we started working directly with the jockeys at Keeneland, which was a great opportunity. And we quickly learned that the concussion protocols that they were using, the jockeys had a lot of preferences that they were concerned about. And so we slowly started building out this protocol, and it has developed into much more than I could ever expect. I've always been an equestrian. I grew up riding, but I'm actually allergic to the horse. And so I had to figure out a way to not focus on the horse. I would have loved to go and be a vet, but I ended up with a foot injury when I was entering into my undergrad and quickly switched to exercise science because my dad was an exercise physiology professor, and just fell in love with sports medicine and just continued down the research path and went for my master's and then came here and finished my Ph.D. So the GRAM is an interactive digital health system. So we use interactive and wearable technology to measure balance and reaction time. And we hope for it to be a tool to improve access to care for equestrians and also put the decision back in their hands. No rider wants to be told that they can't ride. And so one of the big things is this is not a diagnostic tool. It's a decision support tool. There's not always going to be a clinician necessarily running this test on them. They could do it on their own if they're out at a farm in a rural setting. They fall off. A lot of riders just get back on, even if they might not be feeling completely great, because it's part of the sports culture. And so if they have something that can show, how their reaction time has changed or how their balance might have changed, then they can decide if they still want to get back on after seeing those statistics. Overall, I just want to improve the access to care for equestrians. I want them to feel better about the tools that are being used. My name is Michaela Keener, and I'm a UK Innovator.